from the News Channel 5 network. This is OpenLine.
Good evening, everyone, and welcome to OpenLine. Thank you for being with me tonight. I'm Carrie Sharp. Great news coming up, great information coming up in this next hour for you. We're going to be joined by a face and a voice that you are very familiar with over the past couple of years now, Dr. William Schaffner from Vanderbilt University Medical Center. He is joining us to not only talk about COVID-19, but also monkeypox. We'll touch on polio and flu season's coming up, so all things infectious disease. I know you probably have questions, especially about monkeypox, as it is really just becoming a part of our news cycle. So this is OpenLine. It is your chance to call in and really ask the expert tonight. Number is on your screen, 615-737. Plus, let me bring Dr. Schaffner in. Thank you so much for being with us tonight and hanging out for the next hour. It really is nice to speak to you. I've seen you do so many interviews over the past, what, 2+ years now?
Well, Carrie, it's an opportunity to educate, right? Get good information out and respond to the questions that are surely out there on the part of the public. So call in, please, and I'll do my best to respond to your inquiries. Yeah,
you've done so many of these interviews since really COVID-19 became a part of our vocabulary in early 2020. And you have taught us a lot, not just here, but, you know, I've seen you all over the networks nationwide. So thank you. First of all, thank you for that. And I know that you have been at this infectious disease stuff for a very long time. I was reading your biography. You even did a stint back in the day at the CDC.
Yes, that's right. Back in the days when you had selective service, a draft, one of the ways you could fulfill your draft obligation was to become an officer in the United States Public Health Service. You had to apply. Not everyone was accepted. I was glad to be accepted, and they assigned me to the Centers for Disease Control in Atlanta. Back then it was known as the Communicable Disease Center. Same letters, slightly different name, and the prominence of infectious diseases has continued since that time.
What piqued your interest so very long ago about infectious disease that made you decide to make a career of this?
You know, that's hard to say. I really think it was more heart than it was mind. I was just attracted to the pioneers in infectious diseases who defined a whole series of epidemics that affected humanity and then did the studies and introduced the vaccines and the antibiotics that tried to curtail them. And I also liked the idea that we infectious disease doctors had an array of antibiotics so that we could treat and cure many infections, but we also had to do with vaccines. Vaccines prevent disease. And I quickly decided that prevention, of course, was the highest goal of medicine.
Well, we've talked a lot about COVID-19 over the last 2 years, and we're going to continue to do that tonight, and that's where I want to jump off. But I'll remind my viewers who are just tuning in, if you have questions about COVID, monkeypox, polio, flu, this is your time to ask. I'm going to start with COVID. And just the changing information we continue to get, which we should be used to by now, but just within the last week or so, the CDC really came out with some new information about quarantining, isolating, testing. Can you walk us through some of that? What should we be doing now?
Well, Carrie, as you said, the reason the recommendations have changed and continue to change is that circumstances change. Two major things are different now than they were, for example, a year ago. The first is that we have new variants out there. We have Omicron now. Way back when we had other variants, remember when we talked about Delta, for example? Well, this Omicron variant is so contagious, it can even infect people who've been vaccinated or people who've recovered from the infection itself. Therefore, focusing on cases seem to be kind of futile. The public health emphasis has focused now on preventing hospitalizations, those most severe infections in many ways. So there's less concern about trying to limit the spread and continuing concern about trying to keep you out of the hospital. So that's one thing. the variants have changed. The second, of course, is that by now, as I've said, so many of us have been vaccinated or experienced the virus itself, that the level of protection in the community is much higher than it was a year ago. So these circumstances have permitted the CDC to focus more on preventing hospitalizations rather than trying to prevent every instance of transmission, because we know we can't do that with a contagious Omicron. And that's, of course, why they've said now, if you've been exposed, whether or not you've been vaccinated, you don't have to quarantine anymore. They saw that as futile. And they said, instead, just wear your mask for 10 days. And after 5 days, you can get one of those home tests, or the more fancy, we call them PCR tests, and decide whether you're really positive or not. So that eases up the way we lead our lives, of course. And then they've continued to emphasize, of course, vaccinating people who are still unvaccinated or not caught up with their vaccines. And they also emphasize, again, trying to keep us out of the hospital. If you're older, if you have underlying illnesses, if you're immune compromised, should you get infected, immediately call your healthcare provider, because now there's an antiviral drug, this drug called Paxlovid, which, if you can take it quickly enough, can also help keep you out of the hospital. So we're in a very different place than we were 6 months ago and certainly a year ago.
Yeah, I mean, are you surprised, even coming from where you sit, just the amount of strides that we have made in 2 years from really a disease that everyone said, what is that? What are we talking about, to where we now have treatments, we have a vaccine, so forth and so on?
Well, whether I look at this as a doctor or as a medical scientist, a public health person, the strides we have made were enormous. It's difficult to remember that when COVID hit us, as I like to say, we opened up our textbooks to COVID, and what did we find? Blank pages. And basically, COVID was new to the world's population. We had no experience. And one of the really exciting things is, whether in the laboratory, developing new diagnostic tests, new treatments, new vaccines, whether at the bedside, learning how to care for patients in a much more effective way, or working in public health, figuring out how this virus is spread and how it moves about and which people are at greatest risk. The research in all of those areas has been stupendous. We've learned an extraordinary amount, and we've tried to communicate it. But of course, as we learn more, we have to change what we've said. And that does make some people uncomfortable. I'm still told from time to time, why don't you folks just decide on something and then stick with it? Well, you wouldn't want us to stick with it if we learned something new that let us do something better, and we try to keep that up. It does mean that the average Jane and Joe has to do their homework. Yeah. We all have to keep up together. And we have to I try to help folks keep up.
And we have to remain flexible, and sometimes that can be very hard. Okay, let's jump to the phone lines. We have Gordon on the line. Gordon, thank you for breaking the ice tonight and being our first caller. Go ahead.
Yes, this new medicine they're talking about for the COVID vaccine and things like that, is it going to be as deadly as the COVID vaccine was? Because it killed thousands upon thousands, regardless of what scientists say, regardless of what the media reports, regardless of what's said throughout the White House and the government. This medicine has the same makeup as does antifreeze. It has some of the same antibodies. We know antifreeze kills animals, so is this going to do the same thing to the human race?
Okay, Gordon, thank you. Dr. Schaffner, I'm sure this is not the first time that you have heard this, so I'll let you have the floor.
Well, I have not. And Gordon, I know that I don't have enough time to try to persuade you otherwise. The COVID vaccines have been extraordinarily safe. And we in the United States actually have, most people don't know this, the best program of any country in the world to do surveillance. That is, we constantly monitor the safety of all the vaccines that we use in infancy, childhood, adolescence, and adulthood. And we certainly have done that with COVID vaccine. They are just extraordinarily safe. And of course, not just we in the United States, but countries around the world have given them now in the millions upon millions of doses. So those data are really very, very firm. I'm sorry you're still concerned about this profound safety issue that you have mentioned, but COVID vaccine is extraordinarily safe. We have picked up some serious adverse events associated with COVID vaccine. For example, you remember the J&J vaccine that was out there. Well, we discovered in a few cases per million doses administered, this vaccine was associated with an extraordinarily rare blood clotting disorder. I mean, it was less than a needle in a haystack. It was discovered, defined, discovered that younger women particularly were at higher risk of this disorder, that information was transmitted to everyone, including the medical professions, and as a consequence, virtually none of that vaccine is being used anymore. So we found a very rare problem, defined it, communicated about it, and intervened to eliminate that hazard. That's been the story from the very first day that we started to use this vaccine. Please be assured of that.
Gordon, thank you for your call. We're going to take a quick break and then we're going to come back. Mike, I know you're on the line, so we're just going to keep taking your calls as they come in tonight. Stay with us.